Imipramine is a tricyclic antidepressant indicated for the treatment of depression and to reduce childhood enuresis. In this video, let's found. What is imipramine? What is imipramine used for? Contraindication. What are the side effects of taking imipramine? How does imipramine work? How to use imipramine? What is imipramine? Imipramine, sold under the brand name Tofranil, among others, is a tricyclic antidepressant mainly used in the treatment of depression. It is also effective in treating anxiety and panic disorder. Imipramine is taken by mouth. Imipramine was discovered in 1951 and was introduced for medical use in 1957. It was the first TCA to be marketed. What is imipramine used for? For the relief of symptoms of depression and as temporary adjunctive therapy in reducing enuresis in children aged 6 years and older. May also be used off-label to manage panic disorders with or without agoraphobia, as a second-line agent for ADHD in children and adolescents, to manage bulimia nervosa, for short-term management of acute depressive episodes in bipolar disorder and schizophrenia, for the treatment of acute stress disorder and post-traumatic stress disorder, and for symptomatic treatment of post-herpetic neuralgia and painful diabetic neuropathy. Contraindication. Combining it with alcohol consumption may cause more drowsiness, necessitating greater caution when drinking. It may be unsafe during pregnancy. Side effects. These side effects can be attributed to the multiple receptors that imipramine targets, such as serotonin, norepinephrine, dopamine, acetylcholine, epinephrine, histamine. Central nervous system, dizziness, drowsiness, confusion, seizures, headache, anxiety, tremors, elation, weakness, insomnia, nightmares, extrapyramidal symptoms in geriatric patients, increased psychiatric symptoms, paresthesia. Cardiovascular, orthostatic hypotension, ECG changes, tachycardia, hypertension, palpitations, dysrhythmias. Eyes, ears, and throat, blurred vision, tinnitus, mydriasis. Gastrointestinal, dry mouth, nausea, vomiting, paralytic ileus, increased appetite, cramps, epigastric distress, jaundice, hepatitis, stomatitis, constipation, taste change. Genitourinary, urinary retention. Hematological, agranulocytosis, thrombocytopenia, eosinophilia, leukopenia. Skin, rash, urticaria, diaphoresis, pruritus, photosensitivity. Pharmacodynamic. Imipramine is a tricyclic antidepressant with general pharmacological properties similar to those of structurally related tricyclic antidepressant drugs such as amitriptyline and doxepin. While it acts to block both, imipramine displays a much higher affinity for the serotonin reuptake transporter, the norepinephrine reuptake transporter. Imipramine produces effects similar to other monoamine targeting antidepressants, increasing serotonin and norepinephrine-based neurotransmission. This modulation of neurotransmission produces a complex range of changes in brain structure and function along with an improvement in depressive symptoms. The changes include increases in hippocampal neurogenesis and reduced downregulation of this neurogenesis in response to stress. These implicate brain-derived neurotrophic factor signaling as a necessary contributor to antidepressant effect, although the link to the direct increase in monoamine neurotransmission is unclear. Serotonin reuptake targeting agents may also produce a downregulation in beta-adrenergic receptors in the brain. Mechanism of action. Imipramine works by inhibiting the neuronal reuptake of the neurotransmitters norepinephrine and serotonin. It binds the sodium-dependent serotonin transporter and sodium-dependent norepinephrine transporter, reducing the reuptake of norepinephrine and serotonin by neurons. Depression linked to a lack of stimulation of the postsynaptic neuron by norepinephrine and serotonin. Slowing the reuptake of these neurotransmitters increases their concentration in the synaptic cleft, producing knock-on effects in protein kinase signaling, which is thought to contribute to changes in neurotransmission and brain physiology, which relieves symptoms of depression. Half-life. Imipramine has a mean half-life of 12h. Its active metabolite, desipramine, has a mean half-life of 22.5h. Dose. Depression. Outpatient, 75 POQ day initially, may increase to 150 mg per day gradually, not to exceed 200 mg per day outpatient, may give in divided doses or single dose HS. Inpatient, 100 to 150 mg/day PO, may increase gradually to 200 mg per day, if no response after 2 weeks, may increase further to 250 to 300 mg/day, not to exceed 300 mg per day, may give in divided doses or as a single dose at HS. Maintenance dose, 50 to 100 mg POQ day. Safety advice. AUTGA pregnancy category C, drugs, which, owing to their pharmacological effects, have caused or may be suspected of causing harmful effects on the human fetus or neonate without causing malformations. These effects may be reversible. That's all the information about imipramine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.